Start rolling. So, for those of you that watch the wrist lectures, probably, in my opinion, the cleanest, easiest, especially of the upper extremity, very straightforward. No recess, meaning no rotational, because remember the wrist doesn't twist. So, very linear. One's in the front, the one's in the back, the one's on the inside, the one's on the outside. We'll do some practice and functional examples today. And if you have no further questions, then I'll let class out early if you want to, so that I could start meeting with people if y'all want to go over your test stream. So let's do some practice. First one on the top. So the dumbbell's trying to flex, so she needs extension pullers. We know those are going to be our extensor carpi ulnaris, extensor carpi radialis, and our extensor digits 1. Remember, the thumb is always going to be radial side and the pinky is always going to be ulnar side. So be mindful when you're supinated or pronated. So in other words, we learn our functional muscles from anatomical. But if I'm pronated, the flexor carpi ulnaris is still going to be pinky side. It's still going to be ulnar side. But it may not be medial relative to the thumb, if that makes sense. Does that make sense? That's okay. Let me try that again. So we learn our circles in anatomical position, right? So we have a flexor carpi ulnaris and an extensor carpi ulnaris, or two extensor carpi ulnari. I think that's plural. But those are always going to be pinky side. So in anatomical position, the pinky is medial relative to the thumb, that's lateral, right? What I'm saying is be mindful when I'm pronated, when I wrap my thumb, when my thumb goes medial, technically my thumb is medial globally, but my thumb is still a lateral structure. I just swung it over to the inside. So my extensor and flexor carpi ulnaris is still pinky side, even though it may look now it's on the lateral side if I'm in a prone position. I just be mindful. So that's why for me it's about thumbs and pinkies. The radiali, the flexor and extensor, are always going to be thumb side, and the ulnaris is always going to be pinky side. So that's why I do it that way, so that I don't get tripped up if I'm prone or supine or semi. It's pinky side or thumb side. So we're using our wrist extensors, and if you see flexion, so the arrows are just basically saying, inferring or suggesting, they're going through ranges of motion, they're going down, they're coming up, going down, coming up. Obviously, you know me by now. I'll try to find specific pictures that will indicate before and after. So during the flexion phase of this exercise, those extensors would be working eccentrically. And during the extension phase of this exercise, those muscles would be working eccentrically. Now, I'm just giving you this because I did my dissertation on tennis elbow stuff. But I want you to be mindful when you're gripping things, you're using your finger flexors, which are also wrist flexors. So when you're gripping things and using your extensors, your digits will actually have less of a contribution. And that's what we call neurological, like I am inhibiting my extensors because I'm gripping something. If you're trying to squeeze something, you're going to reciprocally inhibit my extensors. So when you're gripping things and need your extensors, you're going to rely more heavily to the carpi muscles because they don't have to worry about finger function. If that makes sense. All right, let's look at the top right. We use good old versatile Kendall. So gravity, so the thumb, we see the thumb on what we see as the right side. So gravity would be trying to radial deviate. So if gravity is trying to radial deviate us, we need ulnar deviators. I think that would be a good example of a first class, right? These guys pull down so that the other side comes up. So I need ulnar deviators. When the weight goes up, that's actually going to be ulnar deviation. So that would be concentric, right? When I see ulnar deviation in this exercise. And when I see radial deviation, that's going to be eccentric of the ulnar deviators. Who are the ulnar deviators? That's why I love the wrist muscles. Flexor carpi ulnaris and extensor carpi ulnaris. Like they literally tell you they're the ulnar deviation pullers because they're on the ulnar side. What's also cool is there's not a lot of different exercises you can do for the wrist. There's really not. This, do this, do this, do this. There's a couple function things we'll get to, like hammering in a nail. You know, you can use your ulnar deviators concentrically with the hammerhead. We'll get into some practical examples. Wrist is very straightforward. Would this be any different than that one? Just probably supinated or pronated, but it's the same thing. So if we wanted to work the other side, what we would really need to do is do this. Whoever made this probably just didn't understand. You know, they probably, you know what probably happened was they would do this, which is interesting in itself. But it's still thumb side. So this would be working the exact same as that, just in a different radial ulnar joint position. So if we wanted to work radial deviators, we need the external force on the ulnar deviators. Does that make sense? So again, this is where you're going to have working knowledge of being able to manipulate the dumbbells and the weights and the therabands to make sure you're targeting the things you want to target in rehab. You know, if you're trying to work radial deviators, you need something that's trying to ulnar deviate you, so that you can then use your radial deviation pulls. And once again, the reason we spend so much time applying contraction is in rehab therapy, there's going to be times where it's just isometrics. There's going to be times where it's just concentrics. There's going to be times where you just want to do eccentrics. There's going to be times where you want to avoid eccentric load. You have to know when and where these things are happening. Flexors, concentric with flexion, eccentric with extension. The flexors, as I said in the posted lecture, you got more flexors. You have your superficialis that stop here and your profundus that go all the way to your fingertips, because it makes a lot of sense. It takes more force to hold on to something than it does to let something go. If you're holding something heavy, it'll take more force to hold the heavy dumbbell than it would be to let go of the heavy dumbbell. So you don't have to have Herculean finger extensors, but you do have to have some stronger finger flexors. And to get to the fingers, you cross the wrist. So it's like it's like having a string that if you pull here, it's going to also pull there. Okay. In addition, you have that, call it the Spider-Man muscle, copyrighted Brian Campbell Inc. But it just kind of looks, that aponeurosis just kind of looks like Spider-Man shooting a web for that palmaris longus. So that extra, because a lot of times when you're gripping things, no, this is just kind of cool. Have you ever done reverse grip tricep stuff? Yeah. So when you do reverse grip, your limiting factor of holding on is your grip, right? Like literally you have to, your finger flexors are preventing the bar or the handle falling out. When you're prone in this example, the bar is not going to pass through your palm. You're going to have a massive problem. Like in other words, gripping secondary function is not an issue because you're pushing with the palm of your hand. So my point is that when you're gripping, when you're holding something in your palm, it makes sense that you have to have some extra wrist flexors. When you're holding things in like this position, you have to have some extra wrist flexors because you can hold more things pushing in your palm than you can hold things with your fingers being the limiting factor of you holding. Does that make any kind of just practical sense? So we have some extra strong wrist flexors because holding things in an open palm requires there be more isometrics there to hold whatever you're holding in this position. So going through, just making sure we're all on the same page. If you do your circles, we have our flexor carpi ulnaris, palmaris longus, flexor carpi radialis. Our two big finger flexors, superficialis profundus. Those are primary wrist flexors. In grad school, you'll learn some more intrinsic little things, some little intrinsic muscles, but we're just going over the heavy hitters, the muscles most involved, the all-stars. Your extensors, extensor carpi, radialis, thumb side, ulnaris, pinky side. So that's not too hard to learn. You got flexor carpi, ulnaris, and an extensor carpi ulnaris, flexor carpi radialis, thumb side and pinky side. The two pinky sides, like I said on the video, are going to cancel out sagittally and work together frontally, pulling in a direction of ulna. The two thumb sides will cancel out sagittally and work together frontally to pull in the direction of radial. So if you're doing manual muscle tests, you want to maybe take that into consideration. If you were trying to like isolate the carpi ulnaris, you might want to go sagittal resistance and frontal resistance. Like, don't let me push your hand back and to your thumb. You could do combination things to emphasize muscles. And again, you're not holding you accountable for origins and insertions, but this is a real easy one to see. So on pinky side, if you work your way down, you're going to feel a big, hard, floating bone. That's kind of like your patella. It's on your ulna side, and it would be right here. You can actually shift it around a little bit. It's called your pisiform bone, and that's actually where your flexor carpi ulnaris attaches to. So when you hear flexor extensor carpi, that just means they're attaching to your carpal bones and specific carpal bones. But that's why they get their names. But that one I always like because you could actually feel it, and it floats when it's not contracted, but when it contracts, it locks it into place. Pisiform bone, for those of you that are going to be therapy or physical therapy or massage therapy or athletic training. When I was an athletic trainer, I love using my pisiform bone as like when you're trying to get out like spasms and stuff. It's almost kind of like using your elbow, but in your wrist. It's just a good little hard little point to get up in there and make athletes cry when you're trying to work out spasms. But that's why they call them their name, flexor carpi. It's a flexor that's pulling on some carpal bones that's on the ulna side. So their function is given to you in the name. I love muscles like that. So ulnaris just means ulna deviating. Radialis just means radial deviating. So I hope that we get all the wrist questions right, because they're really really straightforward. What wrist muscles would I be stretching here? Would I be stretching flexors or extensors? Yeah, absolutely. It's in an extended position. So you'd be stretching flexion pulls. Yeah, absolutely. Now, in the lower extremity, we're going to do a couple of party tricks. In the lower extremity, we talk about link tension. Upper extremity, it's not. Do a couple tricks with you. That's those music. This might lead of new power and three difference. Halloween celebration, communion, new power. So in the upper extremity, it's not so much link tension issues as what we call active and passive insufficiency. I'm going to explain those concepts. We're going to apply those concepts. But first, I want you to think a lot of when we did link tension for the lower, a lot of it was like, you have these big, powerful, moving, propelling us forward, big, strong, powerful muscles. Up here, it's more dexterous. There's a lot more movement. There's the upper extremity in a lot of our activities of daily living is much more open chain. You know, push-ups are closed chain for the upper, but how much of your life do you spend doing push-ups? It's more open. So there are different things that come into play with these dexterous, these more fine-tuning moveful things. The first one I'm going to teach you is passive insufficiency, meaning that a muscle is so stretched that it inhibits the function of its antagonist. Sounds weird. That would be like saying, if I'm flexing my hip and my hamstrings are so tight that my hip flexors can't move my hip anymore because its antagonist is stopping my motion. So this is the first example I'm going to show you of what we call, so this is what I'm dressed up as trash for Halloween. No, I'm joking. So did I ever tell you, I got to explain why I have a bag of them for you. So one of my former students is a physical therapist at Tri-City Physical Therapy Clinic called, love him to death, great dude. And we've been working on my neuroma. I have a neuroma in my foot. And he told me right away, he was like, it's tough to treat. I was like, all right, we're going to try some different things. So what I find is that heat gives circulation. You know, when you put heat on something, it circulates. And that's one of my problems with my neuroma is that it's, I lack blood flow to my periphery as I'm getting older. So I started thinking, I was like, people will wear sweatsuits to get heat. And so literally tying the bag around is like creating a heat pocket because it's insulated. So it's creating a heat pocket on my foot. And I'll be darned if that doesn't help minimize the pain that I have in my neuroma. Now, does it look trashy? Yeah. But I'm way too old to care. But that's my little treatment for my neuroma during the day is to put, and y'all cheap. I mean, every time I go to the store, I get more. It's a good tool. Maybe one day you're going to be treating a neuroma and you're going to be like, try something I learned in college. Let's see if this works. All right, so back to the point, guys. So before we use our stickers, first thing I want you to do is take an ink pen. And I want you to squeeze and grip the ink pen as much as you can. Squeeze it as hard as you can. I want you to make a mental note of how hard you're squeezing the pen. And I also want you to notice when you squeeze it, you tend to extend your wrist a little, just a little bit of extension of that wrist. Okay. Now, your finger flexors, the strings that are flexing, we didn't have to worry about this in the toes. We're not gripping things with our toes, right? So the same things that are flexing our fingers also want to flex our wrist. And when you flex your fingers, you're stretching your extensor tendons. You think about it. If I do this, I'm contracting the flexors, but I'm stretching the extensors. Specifically in this position, at my proximal and distal interphalangeals, I'm not stretching them at my nose, at my metacarpal phalanges. When I do this, now I'm stretching my extensors in 3 places. This is where it gets fun. My extensors cross my wrist to get to my fingers, right? So I'm going to show you what happens when we stretch those extensor tendons so much that my finger flexors can't functionally work anymore. So flex your wrist as much as you can. Now try to grip your pen. So what's happening is you're stretching your extensors so much that they are literally pulling your fingers away from your grip. That's called passive insufficiency, meaning the stretchy stuff, the elastic stuff that muscles have, you're stretching it so much that it's literally pulling your fingers away from the pen. It's passive insufficiency, example of passive insufficiency. The next cool trick I'm going to teach you is unlike in the toes. So remember in the feet equivalency, we had a flexor and extensor, big toe, hallux. It's big because you know during gait, we have toe off. So that's important to have a muscle designed just for that big toe, a lot of force. But in our hands and fingers, we have a lot of dexterity. So we're going to have specific intrinsic, some of them are extrinsic. All that means is extrinsics come in from outside, like our flexor superficialis and profundus would be extrinsic muscles. The muscles cross the wrist and get to the digits. Then you have muscles that are just inside the hand. We call those intrinsic. Those are typically smaller and more fine tuning. So your hand has a lot more intrinsic and specialized muscles. You have muscles that just wiggle the pinky. You have muscles that just move the pointer. You have muscles that just move the thumb. You don't need that for your toes. You don't do dexterous things with your toes, but you do with your hands. Now, which finger? I think this is kind of cool. Thumb, obviously very dexterous. This one. But your ring finger, you don't necessarily do a lot of fine tuning with your ring finger. So what I'm going to show you is, with this little trick is, I'm going to show you how we don't really have a specific tendon designated for your ring like we do for others because you don't really do dexterous things. So take the little sticker that I gave you and put it in between, sandwich it in between your ring fingers, and then complete the rest of your fingers like this, remember we used to do the itsy bitsy spiral. Okay. Now, what we're going to do is we're going to make a bridge with our middle fingers. So, in other words, all four tips of your fingers should be touching, and your knuckles for your bridge should be touching. Never break. Always keep your bridge open. We don't want to open the bridge. Now I'm going to ask you a simple favor. Without moving your fingers away from each other and without keep moving your bridge, let go of the sticker. And so if you put it like on your pointer finger, if you move it on your pointer finger, you could easily let it go, right? If you move it on your pinky finger, you could easily let it go. But it's just to show you that, you don't have a specialized extensor tendon for your, it's crazy. You might win an RC Cola this weekend. So in grad school, you're going to learn dexterity, especially people that do occupational things where you're going to be working a lot with hands, because occupations, that usually people will use your hands for that. And so there's going to be intrinsic exercises and rehab and things that are emphasizing intrinsic muscles for dexterity. For our class, we're just using big extrinsic muscles that are helping you grip. And because they grip, they cross the wrist in doing so they can help with wrist function. But I wanted to introduce you to that concept of passive insufficiency, which is like our upper extremities version of linked tension for some of the things that our upper extremity muscles do. So on the test, if I say, why can't you squeeze a pencil in a flexed wrist position than you could in a neutral wrist position? And the answer is because your extensor digits are being stretched so much that you literally can't flex your fingers anymore because they're being stretched here, 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 and here. Like they're being stretched in multiple joints. So in other words, in our lower extremity, we talked about how we have muscles that cross multiple joints, right? Our hamstrings cross the knee and the hip. Well, just think about it for a second. Our extensors, our finger extensors, cross here, 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 and here. Like those are all separate independent joints that they cross. So I'm stretching my extensor, distal interphalangeal, proximal interphalangeal, metacarpal phalangeal, and wrist. That'd be like stretching the hamstrings in 5 places, right? That would be super tight. So, cool. I think that's cool. All right, so How do you stretch the extensors? You flex. How do you stretch the flexors? You extend. Radial and ulna is tough to stretch because you don't have a lot of road in the frontal plane. And your endpoints, ulnar deviation you have more of because it's more of a functional, like when you're gripping things and you want to hold your hands level, you're going to have more ulnar deviation. But radial deviation, you do not have a lot of radial deviation. So the stretching in the frontal plane is kind of tough. And let's see what else I was going to say. So if you were holding, let's say, like a carton of milk, and you grabbed it out of the refrigerator, the kind that have the handles in it, you'd be using like your radial deviators, right? Because the milk wants to do this, so you need your radial deviators. And maybe if you were going to pour it, you'd be using those radials eccentric. Pull it back, you'd be using it concentric. A functional task would be hammering. Like if you were going to hammer a nail, and you say, all right, Kendall, so versatile. I know that if I'm going to strike the nail with the head of the hammer, I need it to move faster than what gravity can offer. In other words, if I just let gravity do it by itself, it's just going to do this. And if I make my flexors do it eccentrically, it's going to go even slower. Does that make sense? So in order to hit the hammer on the nail with energy, I'm going to actually want to use elbow extensors concentrically and ulnar deviators concentrically. It's like whipping, a towel. You want the last part to move fast. So in the case of like hitting a hammer, you'd actually want to use your ulnar deviators. Even though gravity wants to ulnar deviate you, I need to make it go faster than what gravity can. So that would be like an example of using your ulnar deviators concentrically. Even though gravity is also true. Guys, outside of that, I don't know what else I can ask about the wrist. Pretty straightforward. Let's see. Oh yeah, just like in 310, make sure you don't learn it. Our circles are anatomical, but when I pronate, just remember, I always say follow the fingers. The finger flexion, the finger grip, the finger flexion will show you the wrist flexion. Follow the fingers. So if I'm pronated and I do this, I need you to understand that that's extension and not flexion. It was a 310 concept, but it still applies to 415. That the front of the wrist is here, and this is still the front of the wrist, right? Because it's relative to the palm. This is still the palm. So just make sure if, I give some example where I start here and do this, that you're not telling me that's wrist flexors. The back. I genuinely don't think there's anything else tricky about the wrist. Now, once we get into the radial ulnar joint, we're going to get into some midway. I hinted at this, like how the rectus abdominis can pull back to the midline. I didn't hold you accountable for it, but I introduced you to it. Now I'm going to hold you accountable to a muscle called the brachioradialis that can be a pronator in a certain position and can be a supinator. It just can't do it at the same time. But if I'm going to teach this to you because we have certain muscles that can switch function based off of your joint position. When we get to the shoulder, the pectoralis major is one up. Down here, it's pulling in the direction of adduction. But if you abduct past 90, it's still trying to pull you in, but now it's an abductor. So globally, it's still trying to do the same thing. Bring the humerus to the body. But down here, it's through this motion, and up here, it's through that motion. So it's very similar. You have a few muscles that can switch function based off of your position. And it makes sense. We'd see that more in the upper extremity because that's where we have the most motion. That's why we don't see. I taught you, or at least introduced you to the piriformis, right? How the piriformis, once we flex past a certain position, now it's pulling differently than we were down here. So I introduced you to a couple of these things, and now I'm going to hold you accountable to a couple of these things. It's going to be important for you guys when you go to grad school. Any questions? Guys, we actually have tons of time. I think all we have is elbow, radiolar joint, shoulder, and scapula. So just prepare. We'll do a lot of practice. We'll do a lot of, but I just want to make sure everybody's prepared for your last test, and at the same time not be bored. All right. Yeah, we'll go. Let me know what y'all win when you get your friends on the little finger tricks.